to McLean. Thank you so much for joining us tonight. What a great crowd. My name is Peggy Coburn, and I am the administrator of McLean's Home Care and Hospice. And I have been asked to moderate this amazing panel of information. And as you well know, the topic tonight is Medicare, everything you ever wanted to know about it and more, probably. And I'm pretty sure there are many experts in the room, but we have a very impressive panel of folks here, so I'd like to introduce them. Directly on my left is Kate Holmes. Many of you may know her. She's in sales and marketing here at McLean, and she is in this capacity tonight, consumer on the street. Kate recently helped her husband sign up for Medicare, so she's just gone through the pleasure of navigating the system, and she'll be kind of that person that says, oh, this happened to me, or has this happened to you? So she's acting as a consumer on the street. Next to her is Michaela Viglione, who is our admissions director at the health center. Michaela is also our community liaison, so she works throughout the entire campus. And she's kind of here as our McLean expert. You know, how does Medicare work with McLean? If you need services here, what does it look like? So she is our on the street. I'm really struggling with these analogies. She knows everything about McLean. And then our last expert on our panel is Urania Rivera-Reyes. And Urania comes to us from Choices, Connecticut. I don't know if you've heard of Choices before, but it is a partnership between the federal government and the state of Connecticut, and it is a program that's designed for Medicare eligible folks to help you navigate and figure out benefits, costs, plans. Urania has, you told me, a lot, many years of working in the Medicare arena in this program, and most recently, the last 8 years, she's acted as a regional coordinator. And every time we have Urania here, we learn so much. So we thought we would kind of kick off with Urania explaining about Choices, because I feel like it's the best kept secret when it comes to all issues Medicare. So Urania.
Hi everybody, good evening. Well, my name is Urania. I work with the North Central. You guys can hear me? No? I'm sorry. What about now? Not yet?
Maybe use this one instead. Yeah, use this one. Is it on?
You have to be loud like Peggy.
Can everybody? No.
No.
We're having some technical difficulties. Okay, so my name is Urania. I work with the North Central Area Agency on Aging. So we're a nonprofit organization that is partnered with the state of Connecticut. So most of our funding are through the state of Connecticut and the federal government. We are a nonprofit that provides Medicare assistance and other programs to individuals over 65 and individuals who are disabled as well. I am part of the Choices program. National-wise, it's called the State Health Insurance Program. So what we do is we educate individuals on Medicare's and their Medicare options, and we help them navigate the entire Medicare system, and we can also provide information or referral if it's necessary for other services that individuals might need. As she mentioned, I've been doing this for about 13 years now as information specialist, so I kind of have some answers for you today, the ones that I don't have. If nobody else has the answers, we'll just get back to you on those. So we're here today to talk about Medicare for a little bit. You know, Medicare, it's federal insurance. A lot of folks pay into it, some part of it, throughout the years that they have employment. Medicare has what we call 4 parts. Part A, which is hospitals. That will cover the hospital portion, skilled nursing facility if it's necessary, and you know, other aspects as well that has to do more with the hospital side. Part B is more for physician services, x-rays, durable medical equipment, and then there's Part D, which is prescription coverage. And then the fourth part will be Medicare C, which is Medicare Advantage plans. It's kind of like the other side. You either have supplemental or you have the Medicare. Those are kind of the parts of Medicare that a lot of people know. There's a huge difference between Medicare Advantage plans and supplemental policies. Those are the two plans that you're going to be choosing for the extra cost that Medicare doesn't cover. Medicare only covers 80% of the bill, and then the remaining 20% the consumer has to either get it through a Medicare Advantage plan or supplemental policy. If you get it through supplemental policies, you're going to be in what is called Medicare, traditional Medicare. So that will means that when you go to the doctor's office, you're gonna present two cards. You're gonna present your Medicare card, and you're also going to present your supplemental policy card. Then, Medicare will pay 80, depending on the plan that you have. For the supplemental, that's the coverage that you're going to get. For Medicare Advantage, it's pretty much similar. However, most Medicare Advantage plans, they have co-pays and co-deductibles that are standard that you're going to be paying when you go to the doctor's office. And Medicare Advantage usually are managed by private companies that manage Medicare dollars. And then you're just gonna have one insurance card, which is the one that you're going to be presenting instead of having two of them. Medicare Advantage plans do cover prescriptions, so there are some Medicare Advantage plans that come with the prescription portion of it. If you go to traditional Medicare, you will need a separate prescription drug plan. The most important thing to do when you're either choosing a standard prescription drug plan or you're choosing a Medicare Advantage plan with prescription benefits is to make sure that your prescriptions are part of the formulary. So the formulary is a list of medications that the plan has that they consider it's appropriate for them to cover. Not every plan covers every medication. There's a difference between formulary drugs and excluded drugs. Excluded drugs are drugs that Medicare doesn't cover at all, so no plan will cover it. And then in the formulary is just the plan chooses what medications they prefer to cover. If for any instance you take a particular medication that your plan doesn't cover, there's some options for you to get coverage through those plans. One of the options will be what we call an exception. It has to do with a process with your primary doctor. The exception will be requested based on the fact that you can only take that medication. So in some cases, individuals have other health issues that prevent them from taking a generic from a particular medication, and they have to take that brand medication. They can switch to a different medication, or they've done it in the past, but it doesn't work with their previous medical conditions. So that's when the doctor will request an exception. There's also what is called step therapy, which means that the doctor will give you a substitute from that medication first, see how you do with that, and then if it doesn't work, then the doctor can request that from the plan. But this is things that have to do with the process, so it won't be able to just sign up for a plan right now and, oh, I'm requesting an exception and it has to be covered. Unfortunately, there's a process for that. But that process has to go through your doctor directly. Currently, we are in what we call the open enrollment period. So it's the annual election period for Medicare. It actually started today, October 15, and it runs all the way until December 7th. During this period of time, what you can do is you can either switch from a Medicare Advantage plan to another Medicare Advantage plan, or you can either switch from a Medicare Advantage plan to traditional Medicare, and vice versa. If you have traditional Medicare, you can enroll in a Medicare Advantage plan, and you can also switch from prescription drug plan 2 prescription drug plans. That's the current enrollment period that we are. There's a new enrollment period, which is January 1st until March 31st, which is called the Medicare Advantage Plan enrollment period. That enrollment period only allows you to switch from one Medicare Advantage plan to another. So any changes that you make during this open enrollment will be effective January 1st. If you are in traditional Medicare, you decide to explore Medicare Advantage, it's not working for you, in the period from January to March, you can either drop the Medicare Advantage and go back to traditional Medicare, or you can switch from one Medicare Advantage plan to the other Medicare Advantage plan. So these are the 2 enrollment periods that everybody should look for, and pay attention. This is the time to sit down with, a person that has knowledge. You can contact the Choices program. We cover the entire North Central region, so we cover Hartford and 37 surrounding towns, this town being one of them. We do have a lot of team members in the community that can sit down with you and can explore your options. We're not insurance brokers, so we do not get any payments. Every information that we provide is unbiased. So with that being said, our main goal is to make sure that you get the benefits that you need. So we sit down with you based on your medications, on your medical needs. We can provide you some options of plans that will work for you. We will never make the final determination. We will never steer you to one particular plan. That will be your decision only. But we can definitely help you navigate that and provide you with different options. For individuals who decide to either keep their plan or they just switch from the open enrollment, unless you have what we call a special enrollment period, you're going to be locked into that plan for the remainder of next year. So if you choose a plan this year, it will, this open enrollment, it will start October 1st. You're locked into that plan until the end of the year, unless you have a special enrollment period. Some special enrollment periods are either you move out of your coverage area. In Connecticut, we don't see that much, unless, I think there's just one county that has one plan that it's only for that county, and I do apologize, I don't recall. I think it's Care Partners, yes, Care Partners. Yeah, here. So if you are in that particular plan, and you switch and they don't provide it in the town and the county that you're in, you can switch. That will be what is called a special enrollment period. If you get any state benefits, that will also allow you to get special enrollment periods. So there's a couple of special enrollment periods depending on the circumstances. However, we do recommend that you use the open enrollment period to make your decisions and make your options, because it's kind of the most important one. We want to make sure you have coverage. If you are in a Medicare Advantage plan, and at some point during next year you decide that you want to drop it and you want to go with a supplemental policy, you can definitely do so, because there is what is called continuous enrollment in Connecticut for supplemental policies. That means that you can enroll at any time without an enrollment period. However, if the Medicare Advantage plan that you have is covering your prescriptions, once you do that transition to supplemental policy, it doesn't bring with you the prescription coverage. And then unfortunately you lose prescription coverage because you will not be able to enroll in a prescription drug plan until the next open enrollment period. So that's something that you always have to be mindful of, because might not work out as planned. For those who don't take medications, and we've seen this a couple of times, individuals don't want to pay a monthly premium. Their plans for next year, the least premium, it's about $8.50. So what we tell our consumers is, even if you don't take a medication, enroll in a prescription drug plan, at least the one that's going to make sure that you have coverage in case of an emergency. Sometimes you might need an antibiotic or anything that's just for a couple of days, that the plan might cover it. It also will avoid any late enrollment penalties. So late enrollment penalties applies for Medicare Part A and B. A in case you didn't complete it the 40 quarters and you're paying a premium for A, for Part B, and then for prescriptions. For prescriptions is a 1% per month that you didn't have a prescription plan. So that means if you turn 65 and you decided that you didn't want a prescription coverage, so you're okay with a Medicare Advantage plan that doesn't have prescription, because there are Medicare Advantage plans without prescription coverage. Or you just go with a supplemental policy, and a couple years down the line, you need coverage, it's a 1% per month. So if you didn't have prescription coverage for 36 months, it's 36% of what the annual base is. For example, for next year, it's $38.99. So the 36% will be from that amount, and it's going to be added to whatever monthly premium you're going to be paying for the year. So that's something to have in consideration. It could be a little bit more than what you're expecting, and those extra charges are the ones that kind of like hit the pockets in certain circumstances. So that's something that you want to look at and prevent from it. I was asked to discuss a little bit about IRMA. So the IRMA is the subcharge for those individuals who make above a certain amount of income. So for a single person, it's about 106,000, and if I'm not mistaken, for couples is 213,000 a year. And I do apologize if those are not the ones, but I think they are. So what this means is that if your income is over that, then your Part B premium is going to be a little bit more higher than what the regular premium is. For next year, it's going to be $206 for Part B premium. However, IRMA is determined based on the previous 2 years of your work experience. So if you turn 65, they're going to determine that premium based on the previous 2 years. However, if there's a change of circumstances and you turn 65 and you retired and your income is not going to be the same, or is not going to be above those incomes that I mentioned, you can request the Social Security Administration to adjust your monthly premium, which is something that we recommend. So if circumstances change and income change, you can definitely contact Social Security in order to avoid paying the higher premiums, because that's, it's based on your income. And of course, a lot of individuals do have to go through that process, because when you retired, you don't make the same amount of money that you make when you were working, usually. Unless, you have a wonderful employer who is willing to, but usually doesn't happen. Okay. So I think I covered the questions that you guys had. If you guys have any questions.
I have a question.
Sure.
Having listened to you, you gave a lot of information. Where can we find that information?
Where?
Yes.
So we did hand out to everyone, this is just a 2-sheeter
Yeah.
that kind of condenses. It was a lot of information, and it can be very confusing. So I encourage you, just as a high level, to look at this as a reference point. But I'm gonna guess Urania's gonna suggest Medicare.gov if you really wanna get in the weeds.
Did everybody get the most recent book too, which is
Kate's Bible.
mine? No, but it's a good reference. It is a good reference. Pardon?
Where do you get that? It comes
You should have received this, if you are Medicare or over 65, the state sends this to you, or the government. This is the
Social
Connecticut
Security.
Social Security sends this to you.
It got lost.
Yes, it got lost? Ah, sorry.
I haven't received it.
You can probably request another one, right? Yeah.
Yes, you can definitely request another one. However, unfortunately, because of the federal government cutbacks, there's a lot of people who no longer work at Social Security.
Who would we request it from?
Well, I do not have as many copies, but I might be able to have 1 or 2 copies. You can also contact Choices. The phone number is 860-724-24
724
6443
64.
43.
Thank you.
And the extension is 268. I apologize. If you want information, if you want for us to be able to mail you, we do have, and I do apologize, usually I bring things. The office was closed today, so after COVID, we kind of transitioned and we work from home, the entire office.
It's just that I know some people who would benefit from reading it.
Absolutely. You can call us and you can request information and we can mail you information. I do have, because of the federal government, CMS right now, it's, shut down. However, before this happened, I was able to make some orders, so I have some pamphlets at the office that have Medicare information. I have some pamphlets that are also specifically for medical conditions like diabetes, how does it work. I have some pamphlets that talk only about Medicare and durable medical equipment. But those are things that we kind of send to consumer based on their request. So they can call the office and we will have staff that will answer their phone calls and we'll send it. As far as the Medicare book, usually it's October 15th, so probably they're still in the mail, I guess. From what we heard, the Medicare cards and the Medicare books should be like an automatic thing. The problem is that, for people to put it in the mail is just, it will be a delay because there's not too many staff, so. But as far as extra information, you can call us. Yes.
Do you have the current chart of the supplemental plans
And
the rates?
yes,
Premium rates?
yes. Unfortunately, I don't have, copies with me, but, I can get your email, if you like, and I can email it to you. For anybody who's interested, I have a little pad, so you guys can give me your name and your email. If you have one, or if you want me to mail you some information, just let me know and we can work on that. Email will be the best option, cause it will be kinda easy to have it there. And then we can move forward on that, I guess.
So everyone has a pad of paper at your seat. So if you would like some information from Urania, if you just want to write down your email address, we can collect them at the end and then she can get back in touch with you.
Please make sure to also write your name.
And not just your email.
Yes.
So Urania, I'm just curious, like if someone were to call Choices, like what is that process? What does it look like? Is there a wait to get a counselor? Do they come to you? Do you do it on Zoom? How does Choices work? Because to me, that's, like I said, the best kept secret out there.
Yes, so, there's a triage process for phone calls, so depending on what you need, is going to go to that particular department. All the phone calls that come to the North Central area pretty much come through the Choices program first. Right now, our phone calls are up to date, so we're answering phone calls from today. We do have some staff in-house staff that will answer your calls. I do recommend, that you give them at least 48 hours, to return during open enrollment. Not right now, but probably mid-November, we might be at those 48 hours, so just bear with us because we cover 38 towns. So we get phone calls from during, today is open enrollment. I will see how many calls we get tomorrow, but usually during the open enrollment, we are within 50 to 60 calls a day. Those phone calls do not take 5 minutes. Usually they take a little bit longer. So right now we're caught up to date, so it's good as far as people calling. You have options. You have the option to either do the counseling session over the phone. You can also use Zoom, team meetings, or you can also request an in-person appointment. So those are options that are available for you as well. So it's, if it's a little bit more easier for you, the information specialist that will handle your phone call, they will let you know their availability upon requested. So the options that you guys want will be there for you.
And what are the kind of things that someone should be prepared to share with their counselor should they ask for your assistance? What are you looking for from them?
So usually the information that we request is your Medicare cards. Always have your Medicare cards with you, your insurance cards with you, just in case we want to discuss what plan you have, to provide you options if you want a different plan. Some individuals bring their income, provide their income. No assets, we don't need any of that information. We just need your monthly income, just in case we screen you for some programs that are available for individuals that might benefit them with their Medicare expenses. So that's something that you should bring as well. A full list of your medications with the dosage and quantity per month, and the preferred pharmacy that you use. Those are kind of the 4 things that you kind of need at the moment. Of course, if you have an email address, that information will be, beneficial, because we can either, after we do our phone session with you or a Zoom meeting with you, I personally like to follow up with an email. Our staff usually follows up with an email as well. So it's good that you provide that as well, so you can have the information.
And how about your doctors? Do you need to know who your doctor is?
So when it comes to doctors, in the case that you want to switch to a different plan, you could bring those, but what we recommend is when we provide you the options for the plans, that you contact your provider directly, because they're gonna be able to tell you, yes, we take the plan, or no. It's the easiest option, just to make that phone call, because it will take a lot of more time going online through that plan and researching and doing all this stuff. So it's easier. You can bring your list of doctors if it's necessary, and if you want us to go through that. However, have in mind that that will take longer, so the session will be a little bit more longer if that's what you decide. But I do recommend that once you have your options, you contact your provider. I've done it myself. Like, I called today to make an appointment, and I was like, do you take this insurance? And they said yes. I'm like, okay, fine. That phone call didn't take 30 seconds, so.
And Kate, you had an experience
Yes.
regarding your supplemental and insurance company.
Sure, I'll see if this works. I'm very loud though. Wait a minute. Let's see. Can everybody, no, I don't think this one works.
It's the microphone.
Microphone.
Yeah.
Hi, everyone. I have to stand when I talk. So anyway, I see some familiar faces out here. Peggy pointed out that I had signed my husband up for Medicare, but I recently had what you call a milestone birthday, and all of my cards said, welcome to the Medicare crew, welcome to the Medicare club. That was what every birthday card I got. Yeah, so I am a proud card-carrying Medicare member, and I'm very, very happy about it. Urania pointed out, when we decided to have my husband, for us to pursue Medicare, you know, I'm a researcher, so the book came, and I was a little overwhelmed because there's a lot of information in it. And so I think we're very, very fortunate in the state to have somebody like Urania and the Choices program. It's a valuable free resource because I found it's really beneficial to ask questions. I ask a lot of questions. And if you don't talk to somebody like Urania or her team, a trusted agent. There are a lot of agents out there, insurance agents, that can guide you through the process. I didn't know about, I'm sorry to say, Urania at the time, and so I did speak with an agent and who really answered my questions, and we were able to arrive at whether we should do a Medicare Advantage plan or whether we should do traditional Medicare with a supplement, which, as I think most of you might know, costs more money. You know, I mean, you've got a traditional, Medicare Advantage plan is basically what you're gonna pay for Part A, where traditional Medicare with a supplement, you're going to pay that $206, plus you're going to pay another 200 and something, typically, without IRMA, every month. And so you have to decide if it's worth it for you, what are you comfortable with? And that's what I found, like, people like Urania and the agents could really help you, you know, come to that decision. I had done a lot of research, presented it all to my husband, thought he would go Advantage because he likes to save money, and he said, no, I wanna go with traditional Medicare and with a supplement. So one experience that we did have in that 1 year, we went with United Healthcare because we thought, okay, that's good. It was more money than some of the other options as far as the supplement goes. I don't know how many people have Medigap or supplemental insurance, but the big thing that I learned was the coverage is all the same. It is all the same. The only thing that's different is the cost. And so we, like idiots, took the one that was higher cost, and in the middle of the year, United Healthcare jacked up the price with no warning. And so I was really irritated by that. So I learned my lesson, went back the next year, and we picked Humana, which was a $50 a month savings, so $600 a year. Now, meanwhile, I hadn't heard great things about Humana Advantage plans or coverage in our area, so I was nervous about it, but what I learned was, if your doctor or whatever practice you go to accepts Medicare, they must accept your Medicare supplemental program. They have to. If they accept Medicare, they must accept it. I even went to our doctor and told them, listen, you accept Humana supplemental or Medigap insurance, and the girl at the front desk said, no, we don't. We don't take that. We don't take, because she knew not a lot of people accept Humana Medicare Advantage around here. And I said, I had to explain to her that she had to accept it. So my advice on that is, you know, sometimes your research, trust your research and trust the advice, and sometimes you have to educate the people in the doctor's office, but we went with that less expensive one and saved $600. And the other thing, I know when you talked about the drug situation, we made a list of the drugs and the formulary, and we went with it's in the back of this book. I'll let you look at mine, Patrick, you can borrow it. In the formulary, we went with something called WellCare, which also, I think it's like $16 a month. And that was fine, and prescriptions were costing like $5 for my husband. One time I went to go pick up a prescription, and all of a sudden they said that'll be $240. And I go, oh, no. I love them, but I don't love them that much. I'm not picking this prescription up. And so what had happened was the doctor had switched the same medication from 20 milligrams to 40 milligrams. And when I went on the WellCare site, 20 milligrams was like tier 1, and 40 milligrams was like tier 3. So you can step back a day and not take a prescription if you want to do a little research if something like that happens to you. So I went back to the doctor and said, we need a double prescription of 20 milligrams instead of 140. And that's what happened, and we went back to $5 instead of $240. So I'm hopefully, if you're not a researcher, you're married to a researcher, you have somebody in your life, I see Mary Beth's, you like to research things, because it really does pay off. And the more information you gather when you're doing this, this isn't in our state, but I know my sister had an Anthem in Massachusetts, Medicare Advantage, they dropped it this year. So there's a lot of, am I right, Urania? There's a lot of changes happening now. So when you make this, when you get into open enrollment, I would say, Urania mentioned this, I would, if you're choosing a new plan, the first thing I would do is call every doctor that you go to and say, do you accept, Anthem, United, Humana, whatever it is, if you're doing an Advantage plan. If you're doing a traditional Medicare with a supplement, as long as they accept Medicare, remember, they have to take it. So you can shop price and get the lowest amount. We haven't had any issue with that Humana supplement. It was the exact same coverage as the expensive United Healthcare. I sound terrible with that, but I was mad that they jacked up the price in the middle of the year. All right, is that good?
So questions from the audience?
Yes.
Well, I have a question.
Yeah, thank you.
Who's going?
Go ahead.
Who's going?
Go ahead.
Who's
Good.
going?
Me?
Yeah.
I don't know.
You can go.
Yeah, you could go.
Oh, okay. I have a question going back to that Irma
Mhm.
that you mentioned. So you have to do that every year, correct?
The Irma? No.
I mean, I'm sorry. I mean, if you're for your adjusted monthly income, if you're unhappy with the charge added,
So the charge added is only added if your income is above 106,000.
right,
So if when you go on Medicare, your income changes, then it's adjusted based on what you're gonna be making now. Usually it's not something that's gonna be on a yearly basis, because usually once you're retired, your income kind of stays the same
okay.
afterwards, unless it's a huge increase that will put you above the 106, then it won't kind of be
But
necessary.
you can't go back, like my husband died 5 years ago.
Mhm.
So the first 2 years, I know on the on the income tax, there was a big IRMA charge.
Mhm.
But when I was reading this new booklet, it says something if there's been a change in your life,
Mhm.
style, like if you lost your job or there was a death or something. But I couldn't go back and challenge what was done.
No,
Okay.
unfortunately, no.
Okay,
So-
so it has to be right in the present day.
Yes, and it's not more of a change of the circumstances, because it's the same, it's more towards the change of income.
Right.
In some cases, when a spouse passes away, the incomes, the income that your spouse was getting in
Right,
some
it's gone.
situations, it's gone, but in other situations, it goes to the other spouse. So it depends, like if if in your case, his income was gone, then yes, you should definitely call, and request that your, monthly premiums are adjusted.
But that would have had to be done then.
Yes.
Yeah, okay,
You can still do it if you're paying a higher amount right now,
okay,
but they won't reimburse you.
okay.
But don't they base IRMA on a 2-year look back? So if 2 years
Right.
ago, you had a big windfall, you had a big capital gains, there's something, you sold property and had a gain, which made your income, can everybody hear me? Made your income larger, right? So if your income was larger 2 years ago, and then you're getting it this year, they're going to base your IRMA on that 2 years. And that's what I think, Urania, you meant, where you could appeal that process and get a lower, maybe get that adjusted down. So you guys can help them with that, right?
Yes. Yes, we can, however, it is on so the IRMA is pretty much based once you start Medicare. So that's when they do the 2-year look back. So it's pretty much moving forward. Once you start on Medicare, they don't reevaluate you every 2 years or every 5 years. It doesn't happen. That's what you're going to be paying. So it's usually only the 2-year look back is prior to you getting on Medicare. Even if when you start on Medicare, we know it's based on the 2 previous years, but as of 65, I won't have that income anymore. You can appeal it right there and then to pay lower. You don't have to wait 2 years for it to, because it's based on the previous 2 years before you turn 65. But the moving forward premium, it's not going to be based on the previous 2 years. So if it changes as of the moment that you have Medicare, as of the moment you turn 65, or in your case, as of the moment that your spouse passed away, you just request it. You don't have to wait 2 years to have the change of income in order to appeal the decision.
Right, so if you won the lottery, like the big Mega Millions or something, and you were 70, because you'd already got it, then they would not change your
No.
amount, because it was just based on that 65 that one time.
Mhm.
Right, I didn't know, that's
And so
good.
by virtue of retiring, that's your reason to say, hey, relook at this.
Yes.
That's the life event that changes your
Yeah.
income.
So everyone should be looking
They
at
look
that.
at your income tax return and adjust your monthly payment, taken out of Social Security, based on your adjusted gross income.
Every year.
Appeal that if it doesn't represent.
No.
Well,
So-
we went through the appeal process 3 times, and that's what.
So what happens is that every year the Part B premium increases. So it's not that they make an adjustment every year. It's not like they go back and look at it. It's because, like right now, for example, for next year, it's $206. So if your IRMA is $25 above that, that's why you see that it changes, because it's above on the current monthly premium. So the subcharge is added to the actual premium. So last year it was it 187?
185 or 187.
187 for 2025. So for a person who makes above 106, let's say that their subcharge is $45 more. That was $45 plus 187. This year, the Part B premium is 206. Your IRMA subcharge is still $45. It's just that you see an increase because the premium went up. If they're evaluating you on a yearly basis, I do recommend that you contact the Choices program for that, because that's not how it actually kind of works.
You have a letter that says, based on your income,
Yeah.
this is your charge. So I think we should all check our info.
Yes, and I recommend that you contact the Choices program for that, because like I said, the letter does state based on your income, but it's because the new premium comes up, so they add that surcharge. So it's sometimes they word it in different ways. If that's happening to you, you can contact the Choices program. Unfortunately, Social Security laid off a lot of people, but we might be able to clarify that for you and help you out with that. But the main standard IRMA is determined when you are 65 based on your 2 previous years.
Where is the best place to go to read about what you're talking about?
Medicare.gov, CMS.
Medicare.gov?
There's a good website called Medicare Interactive.
Okay, and that will give all the options and.
It will give you
explain
some information.
them? I see.
Yes.
Thank you.
If you want to get options on plans directly, the Medicare.gov is the plan finder tool. That's what Choices counselors use in order to provide you with options on what plans will work for you.
So an average consumer can go to Medicare.gov and use the same tool that you folks use and plug in your information, and it will present you with, and I think you've said in the past, generally the 3 lowest cost plans.
So the way the Choices program works is that, well, first, the Medicare Plan Finder tool, it's sometimes easy to navigate, in some cases it's not. So you might kind of find it a little bit confusing, so you might want to contact the Choices counselor. If you're able to navigate it on your own, that's great. So that's the tool that we use. So in the Choices, what we do is we provide with the lowest prescription and plan premium option. So there's an option that you can sort plans based on either ratings or on premium only, and there's an option that is like based on your annual cost plus premium. So we provide you the 3 least expensive plans. So we'll tell you, okay, so this is an estimate, so it's not 100% accurate, okay? So I use the word estimate because it's an estimate. So we can provide you, the first plan says that you're gonna be paying an estimate of $950 for the entire year for your prescriptions and premium. The second option will be $1,100. You know, it will give you the 3 cheapest options and then you make your determination. That's the way that Choices does it. However, if you do it on your own, you can, it tells in the right corner, top corner, once it provides you with the plans, it gives you a sort option and you can choose those options.
So you said something that I read about and I was curious, ratings of insurance plans. Who rates them? Where does that data come from?
So that rating comes from Medicare, but the thing is, the rating is not just on the quality of medications or anything. It involves everything. So it's based on the doctors, it's based on what prescriptions are in the formulary, it's based on if you don't like the customer service when you call, you know. Some plans are low because when they call, a consumer cannot reach a person in 20 minutes and they just rate them low. So there's a lot
So
of,
as consumers, we get asked to rate our insurance companies? Like, how does that happen?
well, no. So it's pretty much based on like complaints that you submit
Oh,
or, but this is the thing, a lot of people complain for a lot of reasons. So you might not be satisfied with United Healthcare. I might be satisfied with United Healthcare, you know? I might be a patient person and I'm okay waiting 5 minutes on hold. You might not be a patient person and 1 minute is too much, so you decide that, I'm complaining because I don't think this is good customer service. There's, you know, sometimes there's the option that, okay, this medication is not in the formulary. You know, I'm okay with that. Some people might not be okay with that and will call and complain because I hear them, but I just don't wanna take it. So ratings are good because of course you're not gonna choose a plan that has a 0.5 rating, you know. That kind of says a lot because it's a combination of everything. So it might be doctors are not good, claims are not being paid for. So you can take a look at that, but in some cases, don't just go based on ratings.
Since you're talking about prescriptions, one thing that a lot of people aren't aware of is the pricing is not just based on the insurance company, but it's also the pharmacy. So you might find a situation where, on a practical basis at your house where you might be buying everything from CVS except one prescription that maybe they're not preferred in that particular category. So that's an option. The other thing is, a lot of times, what I've discovered is some prescriptions cost more through the insurance company than if you go through like GoodRx or some third-party service that's available. And the ideal thing is find a pharmacy that checks that. I found certain pharmacies in my area do not check, because I found that I was getting hit with the highest price, and I happened to find a pharmacy which goes in and checks for the lowest price that's available against your own insurance company. So it makes it difficult when you're choosing, if you only choose the 3 plans based on the meds you put in there. If there's some med that you're gonna take out because you're gonna use GoodRx, that has an impact on which insurance carrier.
Yes, that's correct. However, when we do the screening in the Medicare website, you have the option to choose different pharmacies, up to 3 or 5 pharmacies.
But it does,
So it will,
pharmacies across the line.
it will tell you if it's preferred or not. It will tell you the difference prices as well.
But it'll do, if you have 5 prescriptions, it deals with the 5 prescriptions. It won't say 4 in CVS and 1 someplace else. You've gotta do that on your own, if you're aware of it. Then you can do that.
That is correct. However, the Medicare, the way, I'm not sure if you've ever taken a look at a screening done through the Medicare website. If not, you can contact us and we can, you're gonna be able to see it, because what it happens is it gives you details specifically of how much you're gonna be paying for each medication at the pharmacy. So if you choose, for example, WellCare, and you choose Walgreens and CVS in the screening, it will tell you how much every medication will cost you during either initial coverage or, during the deductible coverage. It will tell you exactly how much that only medication is going to be. So it's a little bit more simpler. So you're gonna be able to see, okay, so these 4 medications on Walgreens, I pay $10 for this one, $20 for this one, and then the other one in CVS, I only paid $7 for it. So it makes it a little bit more easier if you do it through the Plan Finder tool. You don't kind of have to figure that out. It will give it to you right there. Yes.
No,
Okay.
I have a question about skilled nursing facilities.
Sure.
I've read the fine print for both Medicare Advantage. It appears as if you don't have to have the 3-day overnight hospitalization as long as it's medically necessary. So is that still true, or am I misreading my term? And what is medically necessary?
Medically necessary shouldn't vary between insurance companies, but sometimes I find that it does, especially in the post-acute world. Obviously, Medicare Advantage plans are supposed to follow Medicare guidelines, but it depends on the type of case, whether it's orthopedic or medical or cardiac. So basically, you're waiving that 3-night stay. You can be in the hospital or the emergency room for 1 night, but you do have to wait for the insurance company to authorize that stay. Most of the time, I would say probably in my experience, 90% of the time, stays are authorized. Most of the time that they're denied, the patient's very high functioning. They're walking 300-400 feet unassisted, and the insurance company's like, yeah, no, probably not rehab.
Many of my friends have fallen, and that's where it comes to play. One spent 2 nights in the ER, but that wasn't sufficient.
Correct.
And yet, she needed surgery. The other did spend several nights in the hospital. But, and she was approved, but both of them had difficulty walking.
Sure. So the big difference is, were they both traditional Medicare, or did they have Medicare Advantage
The
plan?
one that was denied was traditional Medicare,
Yep.
the one that got approved was Medicare Advantage.
So the key there is, when we say admitted to the hospital, there's a couple different levels. You can be an ED boarder. You could be admitted to observation. You need to be admitted inpatient. And the big thing is, you need to ask. And I tell people when they call, ask what level you're admitted to. Because you can be admitted. I've seen someone in the ED observation for a week, and they're never fully admitted. So then when the case manager comes in to say, okay, let's talk rehab, you didn't have a 3-night stay and everything's gonna be out of pocket, they're shocked. So you really need to advocate for yourself and ask. What I tell people is, tell the case manager to say, I have traditional Medicare and I need to be admitted for 3 nights. You need to be able to advocate for yourself. A lot of times they will work with you. They'll find a way to, make it medically necessary to stay, but you can, I have seen people, like I said, stay a week in the hospital and they're not inpatient. So it's not how many nights you stay there, it's under what level of care.
So the fine print not requiring the hospitalization, but saying it's medically necessary.
So that,
What is medically necessary?
So what that,
it can vary.
so the fine print, what it means when that particular fine print means, when you're admitted in the hospital as an inpatient, that's when it's considered medical necessary. So when it comes to Medicare, traditional Medicare, you need to have those in 3 days. So it doesn't matter if it was just a broken leg or if it was, any other, for traditional Medicare. Most Medicare Advantage plans, they waive that. So a lot of people who have Medicare Advantage plans, they waived it. When in the fine print, when it says as long as it's medical necessary, that's where the doctor, if it's as long as the person is in the hospital as an inpatient, because it was medical necessary for them to be as an inpatient. Unfortunately, those little prints don't specify that, so it kind of, you might read it and you might assume, well, it's medical necessary that I go to a skilled nursing facility afterwards, but that's not specifically what those fine prints mean for. They actually mean that the person be as an inpatient as long as it's medical necessary.
Although you don't need to be inpatient to get authorization through a Medicare Advantage plan, so that's the difference too, is that, sometimes someone will fall and break a hip and not be weight bearing on that leg, and it's not surgical, and they don't admit the patient because there's not much they can do for them. That patient still needs rehab and it's still medically necessary for them because they can't function, but they didn't have 3 nights inpatient. So per Medicare guidelines, they don't qualify. If you have a Medicare Advantage plan, they'll send your information to the insurance company, and the insurance company will make the determination whether or not they feel that they will authorize a stay in rehab.
I have a question. Wait. Does that apply, you keep saying traditional Medicare, does that mean traditional Medicare with a Medigap policy or just traditional Medicare?
Both. Medigap policies do not cover skilled nursing facilities in any way that I've experienced, no.
Yeah. So when I say traditional Medicare, usually is a combination of anybody that has a supplemental plan, it's on traditional Medicare. So as she mentioned, and most Medicare Advantage plans waive the 3 in-hospital stay, so. But as far, if you don't have a Medicare Advantage plan, then it's necessary that you are admitted as an inpatient because it was medical necessary. So that's the portion where she mentioned that you can advocate for yourself to be an inpatient, but if it's not medical necessary that you're an inpatient, unfortunately, might be denied. So.
I have a question with regards to that. So if, let's say you have a Medicare Advantage plan, there are different types of plans. You can have a PPO or you can have an HMO. I know with the HMO costs a little bit more than the PPO, but that's because you don't need referrals on certain things as you do on the PPO. So would a scenario like that apply depending upon?
So it depends on the facility you want to go to,
Okay.
because each facility has different contracts with different insurance companies.
True.
So that would be a discussion between yourself and the facility to make sure they're a network, because that affects your co-pays during your stay. Yeah, it's just a conversation, between the facility. So you want to make sure that if you're going somewhere, like I tell people, you have a hip or a knee surgery coming up and you want to come to McLean, call me so I can check your insurance first, because I want to make sure beforehand that we take a look and we're in network and there won't be any surprise out-of-pocket costs to you.
I realize this isn't necessarily applicable to everybody, but a number of people have companies that take care of a lot of this. How does one go on about a conversation with them about what you're talking about?
Companies as in?
Agents, insurance agents?
Pardon?
An agent or a rep that would, an insurance agent type of person?
Well, I was thinking like some of the large companies, they cover just about most of the medical, but not all. And you can run into a trap where you thought they covered it, but they didn't. How does, what you're talking about, how does one approach the larger companies about this?
So, what he's referring to, there's some companies that have contracted out with like some little other companies, like some insurance carriers, they have like their little case management companies that helps consumers making certain determinations.
Yeah.
So I'm assuming that's what you're referring to.
Mhm.
So some companies do have them. You can just call them and they will refer them, refer you to them. It's like a customer service assistance. There's one, I forgot the name, but there's some contracted companies that do what you do. You just have to call their customer service to see if they have it. Not every insurance carrier does. But however, I do recommend that you do what she mentioned is when it comes to this facility, you can reach out to her, or you can reach out to the facility, or to the doctor, or to whatever location it is directly, and they can tell you if they take the plan or not. Those kind of the little things that you have to do ahead of time, because the insurance carrier will try to direct you to what they feel is right, or because we cover this and we work more with this company, or most of our consumers go to this particular location.
So you're saying run it through the doctor or the medical first?
Yes.
And then make sure that the company is gonna cover it or not?
So if you have a Medicare Advantage plan,
Yes.
and the doctor is in network, the insurance company should cover whatever it is, as long as it's covered by Medicare. If your doctor, usually we see mainly like certain doctors, they don't want to, like, they're part of the network and they don't feel that the plan is paying them what they should be get paid, they decide that they're not taking no more consumers. They can't do that. They either have to remove themselves from the plan's network completely, they have to see you, or they will be penalized and you have to form a complaint and all that stuff. So it's kind of tricky sometimes. You can call your doctor, but sometimes doctors, if they don't feel satisfied with the payment, they'll just kind of tell you no. But just so you know, if you have Medicare Advantage plan or PPO and their doctor is part of their network, they have to see you. It doesn't really matter, they can't just tell you, oh no, we're no longer seeing you anymore because, instead of paying $300, they're paying $200. That's not how it should be.
Can I add something?
Yes.
Just in continuing to talk about Medicare Advantage and especially post-acute, because that's, typically what I do. It's important when choosing a plan, to look if they have out-of-network benefits too. A lot of the PPO plans do. That way, for example, even here at McLean, we don't have a contract with United Healthcare. However, if you have a PPO plan, most of those plans have out-of-network benefits, meaning there is a way to get you into McLean. You might have a higher copay, but we're still able to bill your insurance for the majority of your care. So keep that in mind too, because if you're looking, at any facility for post-acute care, especially if you have a scheduled surgery, see if your plan has out-of-network benefits, because even if the facility technically doesn't take that insurance, a lot of times with out-of-network benefits, it is possible to go where you prefer to go.
Which companies are you in network?
At McLean, here. So we, here, where else? So we take Aetna, we take Connecticut, we take Blue Cross, we take Cigna, and we take the United Healthcare PPOs. I don't list United Healthcare on our list because it's a general no, but if it is a PPO plan, we are able to make that work. So if you currently live on campus and you currently have a United Healthcare plan, give me a call. It takes me 5 minutes. I can check to make sure it's the correct type of plan.
But if a person has Anthem PPO, can they still consider, as you mentioned, out-of-network?
Yes, any plan that has out-of-network benefits, we can try to work with.
Outside of these plans.
Outside of those plans. And sometimes If an insurance is out of network, this is very technical, and 5 nursing homes or rehabs decline, they are then able to go out of network. So some have stipulations with it where you have to be denied by so many in-network facilities before you can use your out-of-network benefits. United doesn't do that, but I do know some plans like Humana does that. So you just need to be aware too, when you're asking about those out-of-network benefits, what is the fine print? What are the stipulations that go along with that? Because that can also, because obviously if you really need rehab, in-network facilities aren't gonna accept you. So then you aren't able to go where you prefer.
Yes.
We were talking about the ratings in the book
Mhm.
for the plans. How would you, if you had a complaint, how would you get your information to whoever registers them?
So, we have access as Choices Regional Coordinators, and, because of the shutdowns right now, CMS is not kinda like, we can't follow through with the complaints, but we have access to what is called complaints tracking module. So we are able to make complaints on behalf of consumers regarding issues. So you will have to contact NCAA and talk to one of my people, and they will forward it to me, and I will make the complaint. So, usually the complaints tracking module is something that everybody uses. Not only the regional coordinators, but sometimes, providers can complain about that as well, without not getting payments or not getting coverage. But again, the ratings are not just based on those. There's a lot of more other things or other agencies that people complain to that determine that. So it's just like us, they can get complaints directly from Medicare. They can get complaints directly from providers. They can get complaints through the tracking module, so the ratings come from a lot of places.
Okay, but your group would be someone to contact?
If you personally, yes, as a consumer, we do not submit complaints as just a general thing. It has to be a consumer complaining for their plan. Why? Because we need specific details. So for example, we use the complaint tracking module if, as you as a consumer, let's say, one of your medications should be in the formulary and you go to the pharmacy and it's not covered. You try to call the plan and you speak to one person and they tell you, yeah, it's gonna get fixed. Next day you go to the pharmacy, you have the same issue, you contact us. As long as you made one attempt and you spoke with one person, then you contact us. Then when you contact us, we submit the complaint, and the complaint, they have to address that within 24 hours, if I'm not mistaken. So there is a process for that. So yeah, but it has to be on a case by case basis, and you have to be the impacted party, because we're gonna need your information. So, because they're gonna have to work on your particular case. Any other questions?
So I have a question about late enrollment penalties.
Mm-hmm.
I'm probably a little unique because I'm a younger guy here. So I'm 64 and a half,
Mm-hmm.
just retired. I have COBRA that will go until I'm 67. So when I turn 65, do I or don't I have to call for Medicaid Part A? I'm very confused.
COBRA is not credible coverage for Medicare.
No, I understand that.
So, yeah, you're gonna be penalized if you don't enroll.
COBRA documentation says, if you plan on continuing COBRA, don't enroll in Part A. says there's a possibility of late enrollment fees. So on one hand it says don't enroll, and on the other hand it says, but there's late enrollment penalties.
You know, I laugh because sometimes the little blueprints that most of these programs, they're very confusing. So you can enroll in Medicare Part A because the Part A is usually free. So, you know, they just tell you kind of like not to do it because it might impact your COBRA benefits, but they shouldn't be saying that. Especially as they know that they're not credible coverage for Medicare. So for Part A, if you work the 40 credits, it's not gonna affect you in any late penalties on that because you worked the 40 credits, but for Part B and prescription is going to affect you. So I will recommend that if you have Part A free, enroll in it because it's extra coverage. And it's good to have extra coverage. However, you might wanna reconsider the whole COBRA, because you're gonna be penalized in the future. COBRA is not considered credible coverage at all. So it's gonna affect you with both Part B and prescription coverage.
Sounds like a great time to call Choices.
Yeah, I try to advocate as much as I can for those little blueprints and those pamphlets with those. We try to do as much as we can, but it's just, it's that.
Anyone have any other questions? So what I heard tonight is, this is very complicated business, this Medicare world. There are 18 different ways to go about it. It's complicated, and that's why we brought Rania here, and we wanted you to know about Choices, because it is probably the easiest way to navigate the morass of options that you have out there. But the other thing I feel like I learned is the importance of being a good consumer, a well-educated and researched consumer, because we've heard a couple questions where in one place the document says this, and in the other place it says that. You know, one person has this insurance, that person has that. It is all incumbent on us to learn as much as we can. This is the most important benefit that we have at this point in our lives. So, you know, continually grow, learn, ask questions, and access resources like Choices, because then you know you'll be on the right path and get the best services and coverage that you need. So I would like to thank our panelists, Kate, Michaela, and Rania. Thank you all for coming. I'm going to give you a little bit of a shameless plug for our next M&M here at McLean, which is on November 11th. And I'll be at that one too. And it's called Your Choice, Your Voice. Is that right? That's right. Your voice, your choice. And this is with our hospice medical director, Dr. Barron, Leah Sellerman, who is our hospice social worker, and myself as administrator, to talk about how to have conversations with your physicians about your choices around the end of your life. What do you want it to look like? How do you communicate that with your physician? And we will have Dr. Barron here, who is a primary care physician who sees patients every day, who can answer questions for you that you might feel like you can't ask your doctor. So we'll empower you with some more education in November on the 11th. So please join us for that as well. So nice to see you all. Have a great night. Thank you.